Imagine this. Two nurses assess the same patient. Both have the same education, the same equipment, the same clinical knowledge. But one patient receives treatment much faster because one nurse communicates clearly and confidently. Communication is one of the most powerful clinical skills you'll ever develop. It affects patient safety, teamwork, patient confidence, and clinical outcomes. In today's video, I'll teach you the communication skills every nurse should master, whether you're a student nurse, newly qualified nurse, or experienced clinician. Let's begin. Welcome to Nurse IQ. Here we learn nursing smarter, practice safer, and save lives. If you're passionate about becoming a confident nurse, subscribe and join thousands of future healthcare professionals learning together. Why communication matters. People often think nursing is mainly about clinical procedures. In reality, communication is one of the skills you'll use most. Every shift you'll communicate with patients, families, doctors, healthcare assistants, pharmacists, physiotherapists, porters, and many other professionals. Good communication helps improve patient safety and reduce misunderstanding. It builds trust, prevents errors, and improves teamwork. Even the best clinical knowledge becomes less effective if it's not communicated clearly. Section 2, communicating with patients. Let's start with the most important person, your patient. Patients may be frightened, confused, in pain, or overwhelmed. The way you communicate can make a huge difference. Hello, my name is Sarah. I'm one of the nurses looking after you today. This simple introduction helps build trust and sets a positive tone for care. Listen more than you speak. Don't interrupt. Allow patients time to explain. Sometimes the most important information comes after a few seconds of silence. Show empathy. Instead of saying, "Don't worry," try saying, "I can understand why this feels worrying." Patients want to feel heard, not dismissed. Use plain language. For example, instead of saying your oxygen saturation is suboptimal, say your oxygen level is lower than we'd like, so we're going to assess you and make sure you get the right care. This builds trust. Before leaving, always check the patient's understanding. Ask, "Do you have any questions?" Or, "Can you tell me in your own words what we've discussed?" This confirms they've understood. Now, let's talk about communicating with families. Family members are often anxious too. They may feel helpless. When speaking with relatives, remain calm, listen carefully, show compassion, and be honest about what you know. If you don't know the answer, say so. Then explain you'll speak with the appropriate member of the healthcare team and update them when you can. Always protect patient confidentiality. Never share information you're not authorized to disclose. Communicating with colleagues is essential. Respectful communication improves teamwork. Speak clearly and avoid assumptions. If you don't understand something, ask. If you're handing over a task, confirm it's been understood. For example, "Could you please repeat back the plan so we know we're on the same page?" This reduces misunderstandings. One of the most useful communication tools in healthcare is SBAR. It stands for Situation, Background, Assessment, and Recommendation. Let's look at an example. "I'm calling about Mrs. Jones because I'm concerned her breathing has become more difficult. She was admitted yesterday with pneumonia. Her respiratory rate has increased to 30 breaths per minute, her oxygen saturation is below her prescribed target despite treatment, and she's become more confused. I'd like you to review her urgently." Notice how structured that is. Clear communication helps call understand the situation quickly and decide on the next step. Good handover should be clear, concise, relevant, and accurate. It must include who the patient is, why they're in hospital, current concerns, and recent observations. Also, treatment, outstanding tasks, and any safety concerns. This ensures safe, effective care. Avoid including unnecessary information that doesn't help the next clinician care for the patient. Section 7, documentation is communication. Your documentation communicates with every member of the healthcare team. Write clearly, be factual, record what you observed, what the patient said, and what actions you took. Avoid opinions or assumptions. Document promptly according to your organization's policy. Clear records support safe continuity of care. Section 8, speaking up for patient safety. Sometimes you'll notice something that concerns you. Maybe a patient's condition is changing. Maybe a prescription doesn't seem right. Maybe something doesn't match the patient's history. If you're concerned, speak up. Escalate using your organization's procedures. Patient safety is everyone's responsibility. Section 9, difficult conversations. Every nurse will face challenging conversations. A patient may be upset. A family member may be frustrated. Your role is to remain professional. Listen actively, acknowledge concerns, explain what you know, avoid becoming defensive. If you cannot resolve the concern yourself, involve the appropriate senior colleague or team member according to your workplace procedure. Professionalism is often remembered long after the conversation ends. Common communication mistakes. Avoid these common mistakes. Interrupting patience, using too much medical jargon, making assumptions, ignoring nonverbal communication, rushing conversations, failing to confirm understanding. Small improvements in communication can have a big impact on patient experience and safety. Let's recap. Communicate clearly, listen actively, show empathy, use plain language, protect confidentiality. Use SBAR when escalating concerns. Give structured handovers. Document accurately. And remember, great nurses don't just provide excellent clinical care. They communicate in a way that helps patients, families, and colleagues feel informed, respected, and supported. If this video has helped you become a more confident communicator, don't forget to like, subscribe, and share it with another nursing student or colleague. Here at Nurse IQ, our mission is simple: learn nursing smarter, practice safer, save lives. Next week, we'll begin our Essential Nursing Procedures series with intravenous IV cannulation, a step-by-step guide for student nurses. You won't want to miss it.